Hello, I'm Dr. Tonya Echols Cole, and I'm an oncologist. Today I'm talking to Mary Brick, a breast cancer survivor. Once cancer treatment is completed, patients may experience a range of feelings, from a sense of relief to anxiety and worry about life after treatment. Mary is here to talk about what it was like for her to adjust to life after cancer treatment. Mary, how did you feel emotionally and physically after completing cancer treatment? And what was it like for you to adjust to what some patients call your new normal?
Well, it took a little bit of adjustment in the beginning because looking in the mirror, I saw somebody completely different from the person I'd seen for 48 years prior to being diagnosed with cancer. The other thing is that I felt that my new normal was a lot different from what was normal for me before cancer. Every time I heard the word cancer or saw the word cancer, I thought about what I had gone through. I thought about my diagnosis. I also thought that I needed to prepare myself for the possibility of reoccurrence somewhere in the future. And so some of the things that I did were to collect research and look online for the newest treatment and the newest studies that came out so that I could share them with my oncologist whenever I saw her, and so that I could just keep them by my side in case I needed them ever again. Some of the other things that were sort of like the new normal for me were, although my family was really supportive during my treatment, it seems like after treatment, everything sort of went back to the way it was before. And it wasn't like that for me because I was always thinking about cancer. I was always thinking about what I needed to do to prevent cancer. And I don't know if my family was really thinking about, what I had gone through. We don't really talk much about it, so I'm not quite sure if they think about it as much as I do. But that's something that, I often wonder. Some of the other differences are that as part of my experience, I'm different physically, mentally, emotionally, and spiritually. I've come to really appreciate some of the smaller things in life and just have a simple gratitude for being present in the everyday moment.
Wow, your new normal has really changed.
Dr. Cole, I have a question for you. How have you seen post-treatment challenges affect your patients, and what can we do to make sure that we get the support we need when treatment is over?
Well, first of all, it's important for survivors, both before, during, and after treatment, to let your physicians or your healthcare providers know what emotional concerns or needs that you have. That way you're plugged into the system from the beginning and you can have that support throughout your entire treatment course. It's common for cancer survivors to have fear, to experience fear, especially during treatment. You always have that fear of, am I going to have some side effect from treatment? Am I going to die of my cancer? And then after treatment, it's common for patients to feel like, is my cancer going to come back? And you always want to make sure that you address those concerns for a patient, but we don't know unless you tell us. So the things that you can do, you can always optimize your health by, improving your diet, a healthy diet, exercise, doing the appropriate follow-up care with all of your physician team, because many survivors have more than one physician that they're following with, and it's important for you to follow up with each physician. And the last thing that I see patients struggle with are side effects from treatment. If you've got, say, lymphedema, or you're having chronic pain as a result of scarring or a side effect from your treatment, you have to really talk with your physician about ways that you can continue your normal routine, but adapt to the changes you need to make for those side effects and get the appropriate treatments that are available to help you manage those side effects more effectively.
That's really good to know. And so what can providers do?
Well, providers can provide mental health screenings and refer if appropriate to clinical or community settings for counseling and support. They can also make sure or teach survivors about nutrition, proper exercise, getting enough sleep, reducing high-risk behaviors such as smoking and excess drinking. They can also make sure that they're getting the appropriate screenings for, say, pap smears or colonoscopies.
It's really good information for me to hear. Thank you. Doctors and nurses have a real opportunity to reduce the impact of problems like these and help cancer survivors like me live happy, healthier lives.
Doctors and nurses need to work with patients to address the possible long-term and late psychosocial effects of cancer diagnosis and treatment, provide coordinated care, and promote healthy behaviors. Conducting recommended distress screening and urging cancer survivors to receive treatment for psychosocial and neurocognitive concerns when indicated is an important part of their care. For access to healthcare provider training and resources and information about the topics discussed, please visit cdc.gov/cancer and chronicdisease.org.